Hi everyone, Wynn Brown here with Heywood Healthcare's COVID-19 update for Monday, January 18th. Thanks for tuning in. I wanted to start today on Martin Luther King Day with some sad news of the passing of Adrian Ford. Adrian was the president and CEO of Three Pyramids and of the North Central Massachusetts Minority Coalition. He spent his lifetime educating and advocating for racial equity. He was a strong partner with our health system and our community at large for many years. He has been an anchor member of Heywood's Multicultural Task Force and our community-based advisory committee. His passion, his kindness, and his energy will be greatly missed. As a health system, we will continue to address systemic injustice through our community-based efforts, such as the Mass Up Initiative, Heal Winchendon, and our Multicultural Task Force, and our continued involvement as members of the Three Pyramids Board and Executive Committee that has served North Central Massachusetts for over 50 years. In addition to our labor practices, our affirmative action employer, and the involvement in the 110 Coalition, which is a coalition of leading executives who have come together to upskill, hire, and advance 1 million Black Americans over the next 10 years into family-sustaining jobs with opportunity and advancement. Today, we remember the legacy of Martin Luther King Jr., who once said, "If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward." This statement is applicable to our work as we continue to do as a health system and the work that must be done for society. We must keep pushing forward, and we will do that collectively as an organization and a community. Going back to our usual update, I don't actually have any updated testing information that wasn't available in time for press today. I do know that I'm sure that the rates are still high and above the state average and didn't miraculously change over the weekend given the testing data that I saw coming through. So a call out to the community to continue to do everything you can to make the right decisions to help keep tamping down the pandemic in our region. Our positivity rate, just on a cumulative basis, is seems to be about 6.67% on a statewide basis, so you can see that it is still high. Particularly looking at the infection rate in our community, it definitely is trickling down or coming down heavily on your health system. We have 29 positive inpatients into Heywood Healthcare today, 5 of whom are in our ICU. So if that isn't a call to action, our highest number yet again, we need everybody to step up and do the right things. And if people you're interacting with are not socially distancing properly or aren't wearing their masks appropriately, please speak up to make sure that we do what we can. We will continue also with our education around COVID-19. So for those staff people who are on the fence and seeking additional education regarding COVID-19 vaccines, there's a video embedded with this email that you can take a look at. And if you have any specific questions, you can submit those through community relations at heywood.org, and we will get our infection prevention specialists to respond to you. And a reminder to all staff that we have all signed attestations of our commitment to stay well, and to remind you that at every time clock, when you punch in, you are attesting that you are symptom-free. So please don't ignore how you're feeling. If you have symptoms, please do the right thing to protect your colleagues, our patients, and stay home. Contact your supervisor, who may direct you to employee health for further follow-up, but please don't come in if you're not feeling well. And in closing, there is a nice picture of Craig Roscoe's work from facilities. For those of you who walked through the 1907 building, right outside the administrative hallway is some original tile that we uncovered during a renovation. And we have learned that there used to be an insignia on that before the floor was stripped, and Craig painted the original insignia back in its place and finished sealing it today. So enjoy that picture of his work, and also as you walk through the 1907 building, a shout out to him and the facilities team for all they do as we continue our journey to be one of the best community-owned health systems in America. Have a great evening.